How are you? Yeah. Okay. Yeah, well, we're gonna get that checked out, okay? Yeah. First things first, I'm just gonna put a pair of gloves on just to keep everything as clean and sanitary as possible. I have not had it, no. Nope. Knock on wood, I have not yet, and hopefully I will not. Yeah. This area it's quarantined, but it's quarantined away from quarantine patients as well, because if you don't have the virus, we don't want to commingle you with people who do. So first things first, while I'm not examining your mouth and nose, I'm going to ask you to put on this mask. So you're just going to put it on like so, put it around the ears, and when the nose is around the bridge of your nose, you're just going to pinch it like this to make a flat transition. Okay, so let's put that on you. Okay, good. Again, pinch the nose. Awesome. Okay, so the first things first, try not to keep messing with your mask. You want to keep the seal as solid as you can. So first things first, I'm going to take your temperature and then we're going to talk to you about some symptoms, okay? Okay, so just put this on your forehead. Okay, 1035, definitely a high grade fever. Yes, we sanitize everything after each patient. I don't do it little by little. When you will sanitize this, I'll sanitize everything. Yeah. Okay, so can you talk to me a little bit about some of the symptoms you've been experiencing? Okay. And when did that start? Right. Okay. And have you noticed the sore throat has been getting better, worse, no different? Okay. So aside from the sore throat, the cough, and the fever, has anything else been going on? Shortness of breath, okay. Okay. Sinus pressure. Difficulty sleeping, okay. Is that just because of all of the other? Okay. Alright. Okay. And have you been in contact with anyone who you know has tested positive or has symptoms that seem relatively similar? Okay. Have you been outside the country in the last 14 days? Outside the state? Okay. Alright. Do you know if there are any confirmed cases in your area? Okay. That's not a deciding factor typically, but excuse the odd glove sizes here. Some supplies are hard to come by these days. Alright. So I'm going to start with taking a look in your ears. Okay. Just because they're not masked up. If you just turn for me. Okay. Good. Okay. Alright. And the other side. while I'm here, I'm going to take just a look in your eyes. Light's a little bit bright. Okay. I'm just going to take a quick look in your eyes. You could just look straight at me. Okay. Yeah, there's some watering of the eyes. Just something we're noticing. It's okay. We're just taking notes of everything. Okay. Can you pull your mask up and down for me? Down off your face. Okay. I'm going to check inside your nose. Good. Alright, so there's definitely some blockage. Do you have a lot of postnasal drip? Yeah, you sneeze a lot. Okay. And what color is that? Okay. Alright, before I check out your mouth, I'm just going to feel around your glands. Okay? Sorry, your sinuses. Get this glove down low enough. My fingertips could feel what's going on. We gotta work with what we got. Okay. Yeah, don't do anything, just sit there. Okay. Yeah, definitely some sinus pressure. Okay, we're gonna check out that mouth really quickly. You can just open up, stick out your tongue. Okay, can you say Good job. Okay, just keep your tongue out. You say one more time. Definitely some pretty serious inflammation in the throat. Okay. Yeah. Uvula is very inflamed. Okay, can you pull your mask back up, pinch the nose, make sure it's all... I'm just going to feel along your glands, under your neck and chin. Lift your head up ever so slightly and then just cradle it in my hands. Okay, perfect. Thank you. Glands are definitely a bit swollen. Okay. Alright. Next thing I'm going to do is just check your lungs. It's a big issue that we're having is with the lungs, with this virus. Okay. So if you could just breathe normally for me, I'm going to check your breathing. Okay. Again, if at any point this gets too much for you, just let me know. Okay. Again. 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 want you to do something that may be a little difficult. If it is too difficult, please let me know. I don't want you to hurt yourself, pass out. We'll have extra issues to deal with, okay? But I want you to breathe in and hold, okay? You don't have to breathe in that deeply. Just breathe in a little bit and hold it for just a couple of seconds, 1 or 2 seconds, and let it go, okay? Again, if it's too much, please let me know. Okay, thank you. Okay, good. 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 Good job. Again. Okay. I want you to take a breath as deeply as you can. I'm only going to do 1 or 2 of these, okay? You do not have to hold it, and again, tell me if it's bothersome. Okay, I just want to check lung capacity. Okay, so if you could just breathe in. Okay, sorry. I think that'll sometimes get you coughing. Sorry. I'll give you a second here then. Okay, you need a glass of water or anything? Okay. Just 1 more of these. Okay. Alright, I'd like to do a couple on the back. But before I do, I think we need to give you a little bit of oxygen because that was pretty daunting for you. I'm just going to put this, if you could take your mask off. Just going to put this around your head. Yeah. Okay. Yeah, let's see. Let's get a more snug. Okay. Alright. Yeah, just take a few deep breaths with that. And then we'll check the back and then we'll give you some more oxygen when we're done, okay? Yeah. Okay. You getting better? Okay. You can just take that down, pull it around your neck for now. Do a couple on the back. Not quite as extensively as the ones on the front though, okay? So don't worry. Just breathe normally. Okay. Again. Again. Okay, I want you to breathe in and hold for just a second or 2, okay? At your pace. Whenever you're ready. Okay. Okay. Good. Good. Okay, I'll give you a second. Yeah. I know it sucks, but I do have to check your lung capacity and the amount of fluid in your lungs, the whole 9 yards. I know you're not the first person to want to punch me in the face during this. Get you coughing. Get you feeling like you're gonna die. Okay. So again, deep breath as big as you can get it, and immediately out, okay? Whenever you're ready. Good. Again. Good. Again. Good. Okay. Check that out. I definitely think that you fit the criteria of someone who does have the virus. So because we have limited numbers of tests, we can't test everyone that comes in with these symptoms. So we do have to do these checks. You can put that oxygen back on for just a moment. Yeah. We do have to do these checks just to make sure that you do fit the criteria, which unfortunately you do. And then we can test you. So I am going to be taking that test. It's just a quick swab. So if you could just just open your mouth. Swab the inside of this cheek. And swab the inside of the other cheek. Okay, let's put that in a package. Seal that. Okay. Now this swab I'm actually going to put in your cheek. Then you're going to hold it there. Hold it there for about 10 seconds. Okay? Just close your mouth like you have a lollipop on that side of your mouth. Yeah. Just keep it closed. Oh. Closed-ish, not taking it out yet. Okay. And we're going to do the same on the other side. Just wiggle it in between the cheek and the teeth. And wiggle it. Okay. Okay, put this away. Alright, so you can stay here with the oxygen. Okay, we're going to move you to a temporary room. So, we're going to move you somewhere until the results of that test come back. It's about 24 hours. Yeah. No, we were having you quarantine at home. We find that it's much safer if we have the space to quarantine you in a separate area from both the general public and the patients that have tested positive. Okay? Yes. So you'll be isolated from them. Okay? Alright, well, keep the oxygen. That should help you, and if you need any more assistance, we'll be here, okay? Alright. Well, I hope you feel better and get better soon. Why don't you get some rest?